Morning everyone, Dr. Eric, your fitness physician here with Dr. Eric Primex. I'm doing a very short video today. Just talk about hormones. November, I believe, is Men's Health Month, and I want to talk about some hormones. We'll talk about female hormones and male hormones. Just a quick talk about testosterone. Obviously, it's the big one that gets all the attention, but as you know, I'm doing a hormonal series right now. I'm talking about all the different hormones, the gut hormones, the brain hormones, the peptides in the body, etc. So, testosterone is massively important for both men and women. So, unfortunately, it's one of those things that with age it tends to drop. It can drop, as young as your 30s and 40s, 15 to 20%, and sometimes as much to a percentage point or more every decade of life, depending on your health and your lifestyle and things like that. Unfortunately, today we're bombarded with all kinds of toxins and xenoestrogens and pollutants, and we're stressed and we're not sleeping, anxiety, and not eating good, and our food's contaminated, all these nasty things. So we have a big uphill battle. These things are accelerating the rate of our testosterone decline, as well as affecting our other hormones, in addition to the natural decline that happens with age. So, a lot of my patients I'll see in their 50s, 60s, 70s and up, but I'm getting more and more guys in their 50s, their 40s, and even in their 30s because of all these factors that I've mentioned. So massively important, and it affects women just as much as it affects men. So biggest thing is what are a lot of the symptoms. Most of the when it comes to hormones, obviously a lot of things can affect your symptomatology, and that's why I do detailed assessment, do a good history and physical exam, look at their lifestyle, look at your sleep, look at your stress, your relationships, your food. All these things are massively important, are the most important thing. And then we add in other things. We talk about fitness, we talk about supplementation, and then the last one, of course, is look at hormonal optimization or peptide therapy. So most of the times it fall into three general realms: mental, physical, and sexual. Mentally, it can affect you in terms of a lot of my patients are saying decreased motivation, decreased drive. They just lost that pizzazz, that get up and go. They just don't care. They don't give a shit anymore kind of thing. Don't want to go to the gym to work out, even though they know they need to go. They're tired, they're depressed, they're anxious, they're moody. They're just not themselves. They kind of lost that zest for life. Physically, a lot of people are saying they're gaining fat. They can't get rid of the fat. They're losing their muscle tone. They can't work out in the gym, or they just don't have that what we call exercise tolerance, or get fatigued. They just can't do what they did. Some guys and men and women will get extra fat deposits elsewhere in their body. Some people can have changes in their skin and their hair, things of this nature. So sexually decreased, libido is the big one. Erectile dysfunction with men, hypoactive sexual disorder, and with women, basically the biggest thing is libido. It can definitely affect performance as well. So all these things come into play. And then the last one I want to mention too is it's a health thing. It's not just about feeling good and working out in the gym and losing the fat and the weight. This is a serious health concern because dozens, hundreds of studies have clearly shown the benefits of testosterone therapy, that when testosterone is optimized at optimal levels, you prevent a lot of these things, as studies have clearly shown that with decreased testosterone levels, there's a lot of health benefits that can affect our morbidity and our mortality. The biggest one for both men and women is osteoporosis, anemia, where you don't have enough blood volume to circulate the oxygen. Obviously, everyone knows osteoporosis is a huge problem. Frequent falls and fractures and all the attendant comorbidities and mortality that can happen. Sarcopenia is a huge one, and I think that's one of the biggest things. That's why I focus so much on muscle. It's the biggest endocrine organ in the body, and as we age, we lose that. We get sarcopenia, meaning we lose our muscle mass. It makes us prone to falls and injuries. Where you can't lift things, can't play with your kids, can't run around, go on hikes and enjoy vacation. Can't lift the weights, can't do a lot of different things, and this can lead to all kinds of other problems. Your muscle is your biggest endocrine organ in your body, and it deals with insulin disposal, glucose disposal, secretes numerous myokines and affects multiple things throughout your body. So as we lose this is a huge problem, as I've talked about in some of my other videos. It affects your global systemic health. People, and with decreased testosterone, there's increased incidence in general, and things such as insulin resistance, diabetes, coronary artery disease, metabolic syndrome, prostate issues such as BPH, and even cancer. And quite frankly, increased mortality. People that are optimized with their hormones, whether it's estrogen and testosterone, all these other ones, quite frankly, they tend to live longer, less heart disease, less osteoporosis, less all these medical conditions. Cancers are decreased, and when women, when they're optimized with estrogen, progesterone, decreased incidence of breast cancer and uterine cancer, decreased risk of osteoporosis, better skin, better health, better vibrancy. So these are a lot of the symptoms when individuals' hormones are off, and obviously these can be when people have optimal hormone levels. all these things can be corrected. So it's not just about looking good and feeling good. It's about extending your life, extending your quality of life, extending your health span, not just living longer, but living better, stronger, healthier, and preventing all these nasty diseases that can happen. So reach out to me if you want to find out more. Message me. I'm happy to do any kind of consultation. See you physically in person to do a history and physical exam and offer any guidance in that regard. So again, it comes down to optimizing your nutrition, your lifestyle, your fitness, supplementation. Of course, there's hormone optimization, peptide therapies, a lot of cool things that we can do. So if you have any questions, reach out to me, and look forward to seeing you soon. Check out my next video series on more about hormones. Take care, everyone.